I'm blessed. I mean, I'm able to be here with my family. I'm here to do what I love, and I'm able to take care of patients. So I can't even imagine everyone around me, what they went through, my family, my kids, my colleagues, my friends. So I'm just blessed, and the reason I don't know why, but you know what? I'm gonna spend the rest of my life thinking about it. It's something we all as a family look forward to. We go every year. I think it's our 8th year, so we were really looking forward to it. It was close to the last run of that day. I just thought I was out of shape, Again, going down the mountain, I was just winded.
And I started to get sick about 12 hours after he did. And it took us 4 days to drive home, and just stumbled on this place, and he was able to get tested, and we knew that we had to make some changes to our plans.
When I came back, I wanted to start operating, seeing patients again.
But that's not what happened.
Yeah, and I was scared that I was like, man, I'm just not feeling well.
He started talking about the emergency room that day, and I freaked out. I didn't want him to go because I was afraid that if he went, he wouldn't come back.
I got admitted on January 12th, 22.
I've been a nurse for almost 4 years now, and to have a personality like that that's larger than life come before you in the ICU being so sick, it definitely touches your heart.
Early in the pandemic, it was pretty clear that the vast majority of people that got put on life support didn't make it.
I was committed and determined not to get intubated because at that point in time, I thought intubation meant death.
The alternative at that point would have been death and just moving to ensuring that he's comfortable at the end of his life. You're talking about a guy that's in his 40s and has 3 kids, and he's a practicing colorectal surgeon. That wasn't really an option.
So I've been a nurse since 2005. I've been working here at Menorah Medical since 2015 in the ICU. The night of Dr. Mizrahi getting intubated, it was very clear that it was time. I just held his hand and told him it was gonna be okay.
I also had COVID, so I had to quarantine. And they had to be my eyes and my ears.
So I called her at least once a day, sometimes twice a day, and I always made sure he looked handsome when Carrie was coming by and brushing his hair and washing his face and everything, so just those little things.
We didn't know if he was gonna walk again. We didn't know if he was gonna be able to have his trach out. We didn't know if he was going to be all there cognitively.
One day I had a breakdown. I just lost it. I said, I think he's gonna die. I still get teared up. But after that, I never gave up hope again because I knew he was gonna make it because he is a stubborn ass. And I'm so glad that he is back with us.
I'm a physical therapist. I have a doctor of physical therapy, and my job is to get them up, and then my OT counterpart is to give it meaning, and together we work to get people home.
Rehab's tough. I mean, as a surgeon, I order it a lot on patients, and I never knew how hard it was.
And the first time up out of bed, I said, it's gonna be the hardest, and he said, okay. And sure enough, by golly, he did it, and we FaceTimed Carrie, and she was in tears. I think I was in tears.
So as an occupational therapist, we look at people's ability to do their day-to-day tasks. So certain things like their ability to get back to getting dressed and just simply doing the things that they need to do each and every day to be able to live their normal day-to-day life.
The therapists were amazing. I mean, Lindsay, Barb, and Braden were very paramount in me getting better.
Seeing someone as accomplished and as well-liked and renowned as Dr. Ben Mizrahi humble himself before the situation of, I can't sit up on my own, this is a big deal. All to a backdrop, we played 90s country every time. And then to achieve his goals was really powerful.
The staff at Menorah, the doctors, the nurses, especially the ICU, the respiratory therapists, They were amazing, and I would not want anyone else to treat my family.
When you work with people like we do, there's so much trust.
I would say it was a team effort, and there were innumerable nurses and doctors and respiratory therapists and physical therapists and dietitians and pharmacists that had a huge role.
You know, I went skiing, little did I know that I was gonna get sick, and it put me at Menorah, right, with all these loving, caring people took care of us, me and my family. You know, I feel like I owe it to them to come back and be better than I was before this.